Drugs acting on the central nervous system. CNS and function. The central nervous system, CNS, controls most functions of the body and mind. It consists of two parts, the brain and the spinal cord. The brain is the center of our thoughts, the interpreter of our external environment, and the origin of control over body movement. Like a central computer, it interprets information from our eyes' sight, ears' sound, nose' smell, tongue' taste, and skin' touch, as well as from internal organs such as the stomach. The spinal cord is the highway for communication between the body and the brain. When the spinal cord is injured, the exchange of information between the brain and other parts of the body is disrupted. To treat CNS disease, some CNS neurotransmitters could be used as drugs. The main CNS neurotransmitters are noradrenaline, dopamine, 5-hydroxytryptamine, 5-HT, and acetylcholine, ACH. Norepinephrine, also called noradrenaline, is a neurotransmitter in both the peripheral and central nervous systems. Norepinephrine produces many effects in the body, the most notable being those associated with the fight or flight response to perceived danger. In CNS, noradrenergic transmission is important in control of mood, functional deficiency resulting depression, controlling wakefulness and alertness. Dopamine functions as a neurotransmitter in the brain. Dopaminergic signaling is associated with reward-motivated behavior and motor control with dysfunction of the dopamine system leading to numerous diseases. Dopamine is important in motor control. Parkinsonism is due to dopamine deficiency, has behavioral effects. Excessive dopamine activity is implicated in schizophrenia, important in hormone release, prolactin, GH, and dopamine in chemoreceptor trigger zone causes nausea and vomiting. 5-hydroxytryptamine, 5-HT, serotonin, acts as a neurotransmitter within the central nervous system, CNS, and peripheral nervous system, in addition to mediating non-neuronal actions in numerous other tissues including the gastrointestinal tract and blood vessels. As CNS neurotransmitters 5-HT feeding behavior, behavioral response, hallucinatory behavior, control of mood and emotion, control of body temperature and vomiting. Acetylcholine is the neurotransmitter used at the neuromuscular junction. In other words, it is the chemical that motor neurons of the nervous system release in order to activate muscles. As CNS neurotransmitters, ACH has effects on arousal, on learning, and on short-term memory. Dementia and Parkinsonism are associated with abnormalities in cholinergic pathways. Acetylcholine is also a neurotransmitter in the autonomic nervous system, both as an internal transmitter for the sympathetic nervous system, and as the final product released by the parasympathetic nervous system. Acetylcholine is the primary neurotransmitter of the parasympathetic nervous system. General anesthetics, or anesthetics, see spelling differences, are often defined as compounds that induce a loss of consciousness in humans or loss of writing reflex in animals. Clinical definitions are also extended to include an induced coma that causes lack of awareness to painful stimuli, sufficient to facilitate surgical applications in clinical and veterinary practice. General anesthetics do not act as analgesics and should also not be confused with sedatives. General anesthetics are a structurally diverse group of compounds whose mechanisms encompasses multiple biological targets involved in the control of neuronal pathways. General anesthesia involves the physiological changes: reversible loss of response to painful stimuli, loss of consciousness, and loss of motor and autonomic reflexes. General anesthetics are administered by inhalation or by intravenous routes. They are classified into two on the basis of their route of administration, as inhalation and intravenous anesthetics. Sedative and hypnotic drugs are more commonly used clinically. Sedative hypnotics are a class of drugs that cause a dose-dependent depression of the CNS function, inducing sedation, sleep, and unconsciousness with increasing dose. Agents in this class of drugs include benzodiazepines, barbiturates, and melatonin agonists. Clinical uses for insomnia, anxiety, preoperative mediations, acute alcohol withdrawal, as anticonvulsants, chronic muscle spasm and spasticity. Parkinsonism. Parkinsonism is a clinical syndrome characterized by tremor, bradykinesia, rigidity, and postural instability. A wide range of causes may lead to this set of symptoms, including neurodegenerative conditions, drugs, toxins, metabolic diseases, and neurological conditions other than Parkinsonism. About 7% of people with Parkinsonism develop symptoms as a result of side effects of medications, mainly neuroleptic antipsychotics. Parkinsonism is characterized by a combination of rigidity, bradykinesia, tremor, and postural instability. It is due to the imbalance between the cholinergic and dopaminergic influences on the basal ganglia. Thus, the aim of the treatment is either to increase dopaminergic activity by dopamine agonist or to decrease cholinergic and muscarinic drugs' influence on the basal ganglia. Psychosis is an abnormal condition of the mind that results in difficulties determining what is real and what is not real. Symptoms may include delusions and hallucinations. Other symptoms may include incoherent speech and behavior that is inappropriate for the situation. There may also be sleep problems, social withdrawal, lack of motivation, and difficulties carrying out daily activities. Psychosis has many different causes. These include mental illness, such as schizophrenia or bipolar disorder, sleep deprivation, some medical conditions, certain medications, and drugs such as alcohol or cannabis. One type, known as postpartum psychosis, can occur after giving birth. The neurotransmitter dopamine is believed to play a role. Acute psychosis is considered primary if it results from a psychiatric condition and secondary if it is caused by a medical condition. The diagnosis of a mental illness requires excluding other potential causes. Testing may be done to check for central nervous system diseases, toxins, or other health problems as a cause. Antipsychotic agents. Antipsychotics, also known as neuroleptics, are a class of medication primarily used to manage psychosis, including delusions, hallucinations, paranoia or disordered thought, principally in schizophrenia but also in a range of other psychotic disorders. Most antipsychotic drugs are readily but incompletely absorbed. Many of these drugs undergo significant first-pass metabolism. Very little of any of these drugs is excreted unchanged. Adverse reactions. Extrapyramidal reactions as Parkinsonism. Seizures. Autonomic nervous system effects and muscarinic effects, increase heart rate, muscle relax, orthostatic hypotension. Metabolic and endocrine effects, weight gain, infertility, loss of libido and impotence. Drug dependence and drug abuse. Addiction is defined as a chronic, relapsing disorder characterized by compulsive drug seeking and use despite adverse consequences. It is considered a brain disorder because it involves functional changes to brain circuits involved in reward, stress, and self-control. Those changes may last a long time after a person has stopped taking drugs. Addiction is a lot like other diseases, such as heart disease. Both disrupt the normal, healthy functioning of an organ in the body, both have serious harmful effects, and both are, in many cases, preventable and treatable. If left untreated, they can last a lifetime and may lead to death. This is about drugs acting on the central nervous system. Thanks for watching. If you like this video, please click I like this, and welcome to leave a message. You must be my biggest motivation to make the video. Please subscribe to the channel, where you'll find more and more medical videos here later. Thanks.